everyone. My name is Dr. Senthil Jayaseelan, and I'm a consultant in anesthesia and pain medicine in the UK. Welcome to another video in the Eye Opener series, which we have been doing on various medical specialties. The idea of this video series is to give some information for our young medical students about different specialties in medicine. This will help the medical students when they are thinking about a career in that particular specialty. So today we have with us Dr. Vanitha from UK, who is a consultant gynecologist. She's also an expert in minimal access and robotic surgery, and she's involved in advanced training in gynecology and colposcopy. Dr. Vanitha is also the college tutor representative on the RCOG curriculum committee. She's an MRCOG examiner. She's international and local RCOG, MRCOG course faculty. She's also a faculty for Chelsea and Westminster Minimal Access Surgery. So without further delay, let's welcome Dr. Vanitha so that we can get some insight into the field of obstetrics and gynecology. Hello, Dr. Vanitha, how are you?
Hello, Senthil. Thank you. That was a very good intro.
And thank you for your time. Thank you for your time. Now, I've got a few questions for you. As a medical student, if I'm thinking about a career in obstetrics and gynecology, what would you say about your specialty to persuade me to take a career in your specialty?
Well, Senthil, it's obstetrics and gynecology is an interesting specialty because it's neither medicine nor surgery. It's a mix of both medicine and surgery. Pregnancy, if you take it, it's just a normal woman who's minding their day-to-day business. But when they get pregnant, it's a normal physiological phenomenon, but completely alters their body, that they have to readjust to this pregnancy. And then their life changes completely after that with motherhood and children and all that. But as an obstetrician, you are then involved with the medical specialty when you're helping this mom to go through the pregnancy. And especially in this day and age when women are more career oriented, you have more and more women getting pregnant at a later age when their body then is already facing some medical problems in the background. So you have to have an absolute knowledge about medical problems as such before you deal with pregnancy associated problems of medicine. Then you have labor, delivery, which involves lots of surgery in the when you're helping the women to with their labor and delivery. And then you have a completely different scenario, gynecology, which has lots of surgical scopes within that specialty. So it's a unique specialty. Normal healthy women come and have a baby and go. And then you have a gynecology, which involves lots of surgery. So I think it's a very, very unique specialty for anyone who's interested in medicine as well as a bit of surgery added to it.
Certainly, it's a very interesting field. I mean, hearing from what you say. But I would like to know if there are any challenges in your field which has ever made you regret taking this specialty. Or if you've not regretted taking it, should I know about any problematic areas in your specialty which I should consider before I make my choice as a medical student?
Well, I have never regretted, whether it is during my training or now working as a consultant, as a specialist, cancer specialist. I've never ever regretted. But it is really something anyone has to, the one thing I would say anyone has to consider is whether that's the right specialty, and also think about within the aspect of obstetrics and gynecology, what subspecialist are you going to become? Because most often obs and gynae is chosen by women, and I've already explained how a normal healthy woman is minding her own business, then gets pregnant, then the life changes completely, because you then have to have a balance between your pregnancy, motherhood, and then comes the work-life balance problem. But lots of times women think when they are considering a career, obstetrics as like it's looking after pregnant women. So you are on call all the time, helping the women with delivery and all that. But lots of time you're not considering within the obstetrics and gynecology how you can make yourself as a specialist more like an office based if you want to specialize in that way. Like you could become a fetal medicine specialist, for instance, where you could just look after women during their pregnancy, scanning and doing any intervention for the fetus if needed, and then handing over the women with their pregnancy to someone else who's happy and willing to do the emergency obstetrics bit. Then when you take gynecology, you could do lots of office-based gynecology these days. For example, colposcopy is you're just helping the women with a screening of cervical cancer program, and then you are dealing with these abnormal smears, which is like an office-based gynecology. And every aspect of gynecology nowadays is more office-based, like you have all diagnoses are done as an outpatient procedure. And nowadays, hysterectomies, laparoscopy, it is within 12 hours, women are discharged. So you yourself don't have any more work left if you're doing a gynae surgery. So I would say that is the biggest challenge, like finding the right balance, finding the right aspect within the obs and gynae is a real challenge, and balancing it out with your family is really important for a successful obs and gynae career.
Excellent. Thank you, Dr. Vanita. Thank you. Now, can I just touch upon a slightly controversial subject here? Now, I'm a male, and medical students, many medical students are males. Now, what do you think about males taking up this specialty of obstetrics and gynecology? What are your thoughts?
Well, in this day and age, there's no difference. There should not be any bias based on sex. But I'm under the impression this video is aimed at medical students from India. Now, in UK, it is not a problem. Within my department, there are 12 obstetrician and gynecologists, 6 of whom are male. So there is an equal proportion in here. Whereas if you're thinking of choosing obs and gynae in India, you're more than welcome. It doesn't matter whether you're male or female, but what you should be then doing is choose your subspecialty within the obs and gynae, depending on where you're going to practice. For example, I don't think in South India, women are still choosing a male obstetrician. Maybe parts of North India, male obstetrician have been accepted as part of culture change. Maybe if you're a male and want to do obs and gynae, then like gynecologists are widely accepted, and I have seen successful surgeons practicing gynecology surgery in South India. So that is, I think that's where you should choose the subspecialty aspect of gynecology carefully if you're a male and want to do obs and gynae.
Oh, thank you. If I were a medical student, you would have made me relax now after hearing your answer. Thank you very much. Now, the next question is, how should I prepare myself to become very good obstetrician or gynecologist? I mean, that's starting from a medical student's perspective.
Well, I think if you're a medical student, you should keep your mind open, because there's always opportunities, and you haven't still understood the whole aspects of various specialties and subspecialties that are available in medical world. So you should really try and understand all different specialties as much as possible. But if you think, okay, obstetrics and gynecology really fancies me, then you should try and spend your time in labor ward, in the gynecology theatres, to understand a little bit more about the specialty. Like, if you're someone who's interested in looking after a lady in labor and able to help and support them during delivery, then that's what you should try and see if that is something that will interest you, and whether that stressful atmosphere, you will be able to cope within that stressful atmosphere. Because having giving a childbirth is although it's a physiological process, it's a painful process. Women has to go through a lot during that few hours. So it's almost like sometimes I've seen midwives and doctors saying it's almost like I have given a birth. So that's a stressful atmosphere, and you have to be there and understand the stress that you had to go through. And if you think that is something you could cope with, then that's when you should consider choosing obs and gynae as a specialty. Now, once you have made up your mind about doing obstetrics and gynecology, then once you have got your undergraduate degree under the way, then you should start doing some exams. Like if you're continuing your career in India, then obviously you need to do postgraduate examination. But if you're considering coming abroad, then start doing your MRCOG Part 1 exam, because if I'm looking at an applicant and I'm choosing them for obs and gynae, I'll be looking at how much interest does this candidate have towards this specialty. I will look for, have they done Part 1 MRCOG? That'll be one of the criteria if we are looking for appointing an ST1 trainee, for example. But if you are doing post-graduation in India and you want to come here abroad, then doing your MRCOG Part 2 and Part 3 exam will certainly help in coming to UK and progressing in UK.
Thank you. Thank you very much for this useful information, Dr. Vanitha. I hope this interview will be useful for our medical students who are watching this program. One thing which I wanted to ask you is that would you be happy to take some questions for the medical students who join this forum in the future, so that you can be a great guiding force for them?
Of course, I'm very much interested in teaching and training. That's why I'm working as a college tutor, and I'm in the curriculum committee and all that. I'm absolutely interested in helping and supporting, whether it's medical students or postgraduate students who want help and advice with MRCOG exam. I'm more than happy to help them.
Thank you. Thank you very much. Thank you. Thank you for your time. Thank you, Vanitha.
Not a problem at all. You're more than welcome. Thank you.